the entry door for the project we're discussing today is actually epidemiology, geostatistical epidemiology, crossing autoimmune disease with environmental factors. That silica exposure is a risk factor for AAV, but also for systemic lupus. And we believe the mechanisms, the underlying mechanisms are the same. Silica exposure is promoting something called netosis. I'm sure you may have heard the name, and it's something very strong in the pathogenesis of vasculitis. And also it activates something called inflammasome, and inflammasome, you hear the word inflammation, brings inflammation in. And this is the mechanism by which silica is connected to the immune system, and it works both for AAVs, but also for systemic lupus. So we were prompt to check whether there were data in the literature about the association between ANCA-associated vasculitis and silica exposure. And the answer is yes. There are already many papers about that, at least 10 of them, studying the relationship between the occurrence of AAVs and the exposure to silica. But the design of these studies are case control studies, so it's not robust evidence. So we thought, well, maybe we should do it using new techniques, modern techniques, and this is precisely what we've done. Our research is in a restricted geographical area, which is called Alsace in the northeast of France. And there is a reason why we used a dedicated area for that, is that we started by doing something called capture-recapture, which is a technique used in epidemiology to count cases very precisely. And that cannot really be done on very large scale. So we have selected Alsace, and in Alsace, we crossed several sources to be sure to identify all potential patients with AAV. We crossed ANCA results from laboratories. We crossed the medical files from hospitals, general practitioners, and so on. And we also crossed in the data from our regional health system. And based on that, we were able to identify around 900 cases. We reviewed all the cases one by one to confirm about 200 cases. We are currently developing an application for personalized counseling for fatigue in inflammatory diseases. So I think patients everywhere in the world will be able to connect and get some personalized feedback about the best way to manage fatigue. So that's a little something, but I think it can help patients with inflammatory diseases, vasculitis, but also other autoimmune diseases. In the context of fatigue, we know that it's highly multifactorial. There are many elements that will combine. You have disease activity, but you also have other parameters. It can be an underlying disease, a thyroid problem. It can be anemia. So this has to be checked up very carefully. And then there are other elements such as depression or anxiety, which are very strong predictors of fatigue. So we've done many studies about that, showing different clusters, different profiles of patients. Some patients have high disease activity and high fatigue. And so the best option is to target disease activity. Reaching remission would improve fatigue. But there are other clusters of patients who are currently quite inactive, but have high level of fatigue. And in that context, it's mostly a very global, very holistic management that should be recommended. So I think that the data we have with this unfortunate pandemic of COVID-19 is teaching us lots of things about autoimmune disease, inflammatory processes. We have a registry in Strasbourg, where I live, of long COVID, and we are really trying to understand the underlying immune mechanisms. What is really fascinating and very unfortunate at the same time is that COVID has some kind of mimicry with brain proteins, and it may explain some memory problems, some fatigue, something which is in the context of what we call limbic encephalitis. And we are really working on understanding these immune mechanisms. There are many ongoing studies in France about vasculitis. There's a very strong network of vasculitis patients, but also vasculitis researchers. And this is, of course, very important for the advancement of knowledge in this context. I think what we are really working on now is the implementation of digital health. developing either applications or at least tools to shorten the diagnosis delay and also to improve the follow-up of patients.